And all right, so we're recording now. So hello everyone. Good morning / afternoon. Thanks for joining us today for our latest installment of Align Online. So our current session is called Undocumented Limbo. It's co-hosted by Joseph Mendoza and Lesley Reyes. So both of them are sophomores. Joseph is a sophomore at Camden County College and is pursuing a degree in public health. He desires to become a public health practitioner focusing on health equity, health policy, and health promotion for underserved communities. Joseph immigrated to the US at the age of 6 and hopes to share his story as a documented student. Now, Lesley Reyes is a sophomore at St. Joseph's University, doing her bachelor's in criminal justice. She plans to pursue a career in immigration law to serve the immigrant community. Last summer, she attended an immigration conference held by the Ignatian Solidarity Network, which encouraged her to initiate an immigration advocacy project back at her campus. So yeah, let's with that introduction out, let's get us started. Lesley and Joseph, take us away.
Thank you. Thank you. So we'll go ahead and share the screen. Oh. Okay. Can everyone see the screen? All good? Yes, maybe?
Oh, right.
Yep.
That's the chat.
Okay.
Yeah.
So we have a decent amount of information, but if anyone has any questions throughout or any comments, please let us know. We can definitely, it'll be better to have a conversation and address any questions or concerns throughout the presentation, okay? Okay, so thank you for having us today. As today we wanted to discuss COVID-19 and we named the session COVID-19 Undocumented Limbo. So as Chris introduced us, I'm Joseph Mendoza and this is Lesley Reyes. So we want to begin with a quote by Ibram Kendi. He's a director of the Anti-Racist Research and Policy Center at American University. And he said that in the United States, an estimated 11 million undocumented immigrants are already social distancing from the old virus of xenophobia that Trumpism has been spreading anew. They live in the shadows, mainly in California, Texas, Florida, New York, New Jersey, and Illinois, the very states, save Texas, that have some of the worst known outbreaks. But tracking and arrest by immigration and custom enforcement ICE officers have not let up during the pandemic. So we want to begin with some simple definitions. Being undocumented, it refers to anyone in the country without legal documentation. DACA stands for Deferred Action for Childhood Arrivals, a program enacted in 2012 by Obama. It gave qualified undocumented young people access to a temporary relief from deportation, work permits, and social security numbers.
And an asylum seeker is someone who is seeking international protection, but whose claim for refugee status has not been yet determined. And a mixed status, someone from a mixed status family is a family member who is from a different citizenship or immigration status. Like, for example, in my family, my parents are undocumented, but me and all my siblings were born here, so therefore we have U.S. citizenship.
Any questions on this? Everyone good? Okay. Just some basic data on COVID-19 by race. We see that what groups are affected most by COVID-19. We know that people of color appear to be especially worried about their own well-being. The Black community at 46% and the Latinx community at 39% are about twice as likely as white people at 21% to view coronavirus as a major threat to their health. Additionally, we see that some recent polls found that 16% of Latino Americans surveyed said they were infected, had been in contact with someone who was infected or knew someone who was infected, compared to just 9% of white Americans. We see that in a separated and segregated society, these results reflect different rates of infection in these different communities. Additionally, in Chicago, where the Black community makes up 29% of the population, they account for more than 70% of deaths from the coronavirus so far. And we see this trend in other cities like New York, Louisiana, New Orleans, and Detroit. Additionally, in one of the most affected zip codes of New York, in Queens, this city has the second highest rate of confirmed infections, and the population is around 64% Latino compared to 8% white. We see that minorities are being affected at disproportionate rates. And today we will focus on one of the populations, which is the undocumented community.
So status and access to services. So immigrants who enter the U.S. legally, for example, single adults and married couples without children, will receive benefits for 8 months from date of entry into the country. Families with children who are 18 years old or younger might qualify for additional benefits, including TANF, Temporary Assistance for Needy Families, and Medicaid up to 5 years. And immigrants who enter as legal permanent residents do not qualify for the majority of public benefits until 5 years of legal residency. Now, immigrants who enter the U.S. without legal status do not qualify for public benefits. Compared to refugees, refugees are assisted by resettlement agencies with English-speaking professionals, whereas immigrants are dependent on their families and neighborhood for agencies. Also, they may be limited by language, unfamiliarity with available services, and difficulty in navigating the healthcare and social service systems. All right, now immigrant eligibility for public programs during COVID. So for cash assistance under the CARES Act, most individuals earning less than $75,000 are eligible for a one-time cash payment of $1,200. Immigrants are not eligible for this aid because they must have valid Social Security numbers. And being undocumented means not having a Social Security number. So this targets low-income undocumented immigrants. In terms of healthcare, there's 2 acts. The Family First Act provides funding for COVID-19 testing for the uninsured and gives states the option to provide testing to certain uninsured individuals through their Medicaid programs. And the CARES Act also increases and extends funding for community health centers. Neither the CARES Act nor the Family First Act alters Medicaid eligibility for immigrants. Some states have defined testing and treatment for suspected COVID virus as emergency services covered by their emergency Medicaid programs, but emergency Medicaid is available regardless of immigration status, but applicants must meet their state's Medicaid eligibility requirements. And in terms of food, under the Families First Act, there is SNAP. It allows to provide emergency supplemental benefits up to maximum monthly benefit amount to many participating SNAP households. Only certain non-citizens are eligible for SNAP, such as refugees and some green card holders. Parents who are not eligible for SNAP can apply for their eligible household members, such as U.S. citizen.
Okay, so what effects is COVID having on the undocumented community? The shadows may have protected the undocumented community from the old virus of attacks, but the shadows cannot protect the community from the new coronavirus. And we have a combination of xenophobia and COVID-19, which leads to the horrible choice for undocumented immigrants. And this is, do I or do I not come out of the shadows? We see that quitting a low-wage job could mean getting deported. Getting tested could mean getting deported. Getting treated could mean getting deported. And if I am arrested, could I be thrown into the ICE network of jails and detention centers where the coronavirus is already spreading? These are thoughts going through the head of the undocumented community in times like these. We see that the coronavirus adds to all the risks that the undocumented population face. Under the Trump administration, immigrants have faced relentless attacks, tightening of the public charge rule, threats to deferred action for childhood arrivals program, raids by ICE, asylum restrictions, and separation of families at the border. So immigrants were justifiably scared. Does anyone know what the public charge rule is? An
Yeah,
idea?
can you go in some depth into what public charge is?
Yeah, no problem. So the 2019 public charge rule, this new public charge rule went into effect February 24th, and it states that aliens are inadmissible to the United States if they are unable to care for themselves without becoming public charges. So this would take their chances away of obtaining citizenship or a green card. And some of the benefits considered as public charges are the supplemental security income, temporary assistance for needy families, any federal, state, local, or tribal cash benefit program for income maintenance, supplemental nutrition assistance program, Section 8 housing assistance under the Housing Choice Voucher Program, Section 8 project-based rental assistance, public housing, and federal funded Medicaid. So an example of what has been happening is that when we see that many low-income immigrants, parents of American children, disenrolled their children from the Supplemental Nutrition Assistance Program, SNAP, fearing it would affect their chances of obtaining legal status in the future or lead to deportation. On the day that this was implemented, there were 14 cases of COVID-19 in the United States. And a month later, with more than 30,000 US cases confirmed, we saw this message on the USCIS website. USCIS encourages all those, including aliens with symptoms that resemble coronavirus disease 2019, to seek necessary medical treatment or preventative services. Such treatment or preventative services will not negatively affect any alien as part of the public charge analysis. So first we see that all these benefits were seen as a public charge, but now the USCIS website is saying it's okay, don't worry, you can seek service. But expecting the undocumented community to trust the government now during the COVID-19 crisis is challenging. Many community organizations, activists, and healthcare providers are trying to reach out to immigrants and encourage them to seek care for COVID if necessary, but these strategies will not compensate them for years of harm. Additionally, if anyone shows signs of COVID or they have any questions, they are told to call their primary care doctor. Stay at home, call your primary care doctor. But unfortunately, many undocumented immigrants, calling their doctor is not an option at all. The Affordable Care Act excludes 7.1 million undocumented immigrants. It excludes all undocumented immigrants, and then we have 7.1 million undocumented immigrants that don't have health insurance at all. Many undocumented immigrants have relied on emergency departments since they don't have access to primary care physicians. An example is a nearby city here, Camden, New Jersey, where the Lady of Lourdes Hospital, the number one reason most patients went to the emergency department was for a head cold. These are things that could be addressed by a primary care physician, but we see that in the undocumented community, these things, it's hard to have access to healthcare when you don't have a primary care physician and you're restricted from any type of healthcare. COVID-19 has exposed the risk of limiting access to primary care for many populations, including undocumented immigrants.
Sorry, can you guys see your screen or no?
We see like half of the screen.
Okay. Let me see something.
Could you try like unsharing and then resharing it?
Oh, there we go. Resume share.
Can you see it now?
Nice. Yep.
Okay. So as Leslie said, there was the stimulus for families, and this uh, 2 trillion COVID emergency bill is one of the largest stimulus measures we've seen, and it will put cash in the hands of many Americans. But there's one group of people that won't be getting a check, and these are undocumented workers. This includes those who pay taxes, and they won't be eligible for any federal help. And the bill does not offer any extra protections to undocumented workers. These are the ones working in factories and fields, and if they get sick, there's uncertainty of what can happen. And I think it does. It goes far enough to say that neither Americans or undocumented immigrants, it doesn't do enough for them, for us, for everyone. And as we see 11 million undocumented immigrants in the nation, all who are working as the backbone in this nation on the front lines, contribute their fair share, but they see zero benefit. COVID-19 is something that is affecting every single person in the nation, and undocumented immigrants are continuing to work with zero relief. And it's a very challenging time. And if people do get sick, we have to think, or will they go for testing? Will they seek treatment if they get really sick? Because Medicaid doesn't cover any type of care. So we have to wonder what is going to happen with the undocumented community. Some additional points include that asylees, their refugee admissions are stopped. The administration has suspended refugee admissions to the U.S. Also, as DACA students, as DACA doctors, this there is the Supreme. If the Supreme Court allows the Trump administration to terminate DACA, there are doctors who are under DACA and essential workers who are under DACA. So what will happen to them? Well, we already have a shortage of medical personnel and in our hospitals because of the virus. So we have to think of that. We see that there's a failure in the administration to provide, to give a response for these 11 million undocumented immigrants. They're confronting the virus and they're assisting all the healthcare field, but they are still in uncertainty with what will happen with their careers or with their life in the U.S. Some solutions that could be done and need to be done are that immigrants are part of our national fabric. Undocumented immigrants make vital contributions to the economy, and many have low-wage essential jobs as home health aides and help the elderly. Others are babysitters and are necessary for families in this crisis. Responding to this epidemic will require a unifying approach. It's difficult to reverse all the years of anti-immigrant policies and rhetoric, but it's essential that the administration addresses the needs for undocumented immigrants in that COVID-19 response. We can start by expanding access to care. The Family First Coronavirus Response Act, which was passed on March 18, provides coverage for COVID-19 testing for the uninsured through National Disaster Medical System reimbursements. This is great news, but it doesn't go far enough. All care associated with patients with symptoms of COVID-19 should be covered regardless of insurance status. Also, it would be important to establish a multilingual COVID-19 hotline to help bring care to those who lack a primary care provider. In addition, as we talked about the public charge rule, it's imperative during this crisis to suspend that public charge rule because the FFCRA increases funding for SNAP and the Special Supplemental Nutrition Program for women, infants, and children in responses to COVID. But given the public charge rule, immigrants may hesitate to obtain nutrition benefits for their children and fear deportation and family separation during these times. So they're uncertain whether they should get some help because they fear that this may have effects to their status in America. And also, eligibility criteria for these benefits should be liberal to ensure that the most socioeconomically disadvantaged, including those with traditional proof of income documents, are not excluded. Finally, low flight risk immigrants should be released from detention centers facing the threats of COVID-19 in prisons. We see that local jurisdictions have begun reducing inmate populations by identifying people that have been detained for minor crimes or vulnerable to severe infections because of condition or age. So a similar process can be applied to detention centers. So we need to see an inclusive message from very high levels of leadership in the country. And this might not reverse the COVID's impact on the undocumented immigrants, but it will help them and it will help everyone at a public, it will help the public at large. I see someone commented, there have been stories in the news.
So the only specific protections for undocumented people in regards to medical care, I know for so there are community health centers that do not check for immigration status or if they have any type of insurance. So those are the only ones that I know as of now. The community health centers are the ones helping.
I know I believe the government said they're trying not to have any type um, of like ICE raids, or they're not trying to target anyone in healthcare facilities or anything of that sort to minimize the minimize the stress for undocumented communities. But it's still they still have that in the back of their head, like what if in the back of their head always shows. Do you have any reliable? So we have some resources at the end. So, and if there's anything else you would like, you can always email us. We have our contact information at the end, so we can provide that as well.
Also, thank you, Sil, for your comment.
And something that was really good recently that I saw was the mayor of Chicago, Lori Lightfoot. She signed an executive order to ensure refugee and immigrant communities have equal access to benefits and services provided by the city in the COVID-19 relief. She said that this order is more than just an official decree. It's a statement of our values as a city and as Americans. Since COVID-19 first reached our city's doorsteps, we have been working around the clock to ensure all our residents are secure and supported, including our immigrant and refugee communities, who are the most vulnerable to the impact of this pandemic. Here in Chicago, she said, "We're all in this together," means that during this crisis, no one gets left out and no one gets left behind. I think that's really powerful to say that as the mayor of Chicago. So I feel like that's a great step forward in our country.
Yeah, if you don't mind me butting in, yeah, as a child of refugee immigrants, like I feel like the protections afforded to refugees are a lot disproportionately greater than the protections afforded to other immigrants, and the distinction between whether an immigrant counts as a refugee or not is often arbitrary, and like very highly sensitively dependent on geopolitics. And so, and the people who get the short end of the stick are the actual immigrants. I do have a question. I have a comment and a question. So the comment is, could you guys read the questions, because we'll be posting this on YouTube afterwards, and so people won't be able to see. I mean, people will be able to see the chat in a separate file, but just to keep everything uniform. But also, my question is there a database for community health centers out there that people know, like, you can go here if you are undocumented and receive treatment and not like face stress for ICE raids or things like that?
So there is a website. It's called immigrantrising.com, and they have a state-by-state either hotline or centers across the different states that provide access for any immigrants who may have health concerns. So I think that's really helpful. We can share the link, and we might have it during this presentation, but if we don't, we do have the link for that as well.
All right, cool, thanks.
No problem. Any other questions, concerns, comments? Nope. I think we're good.
Okay, so now we're going to be talking about first-generation low-income students and undocumented students and the intersectionality of these identities. So just briefly, so we have for intersectionality, we could do race, gender, being first-generation, low income, and also your citizenship status and how this affects you and your identities all coming together and how it affects your future and yourself. So like, for example, race, there's a big difference between a Irish, Polish, Italian immigrant who may look passing versus a brown immigrant versus a Central American immigrant. Race is a big factor. And so DACA in the times of COVID-19. So already DACA recipients are facing a stress because it's already difficult to file for the immigration process to renew their DACA status. DACA recipients especially are facing now new challenges as they try to renew it because the Supreme Court is announcing a decision. And so right now the decision can be made any day from now until June, whether the program can continue or not. And this just weighs very heavy on DACA recipients as they're doing their homework, as they're attending class, as they're going to work. It's just an added on stress factor.
And as a DACA student myself, that's definitely true because we are awaiting a decision from the Supreme Court whether DACA will be rescinded or if DACA will be supported, and that's something that stays in the back of your head. You also have school going on, work, and I believe sometimes professors don't understand all these other things that may be happening. So it does take a toll on your health or your mental health to have to think about all these things going on in addition to COVID-19. So I think that's a very big point.
So in terms of mixed status families, so not only as a member of a mixed status family, not only living with the fear of deportation, but now living with the fear that my parents could get this disease and not being able to obtain the proper resources to combat this disease. That also adds on a stress factor to me as a student. Okay. All right, so now advocacy and support, our call to action. It's time to do something now that we've educated you and have given important information about how COVID affects the undocumented community. So first and foremost, shut down detention centers. So ICE is saying that they're promoting life-saving activities, but ICE should really be releasing these low flight risk detainees who are in custody. And a flight risk detainee is somebody who, if they're released from court, if they're released from these detention centers, they will flee away and they won't be able to come back to hear the rest of their court decision. Also, according to ICE, protocols are in place to screen and isolate detainees with COVID-19 symptoms, but the infections transmitted through these droplets are particularly difficult to control in detention facilities, since 6-foot distancing and proper decontamination of surfaces are virtually impossible. All right, so here I have, so in Pennsylvania, there's the Berks County Detention Center, and this detention center holds family immigrants who are seeking asylum, and they have reported physical abuse, verbal abuse, and medical neglect inside the detention center. And now with the threat of the coronavirus, these families are at even greater risk. And I also have this link here that we could, it's a petition to shut down this detention center. So I'm just gonna input this in the chat and hopefully everyone can sign. It's just your name, your email, and I believe,
We'll put it in the
Okay.
we'll put it in the chat afterwards. So it'd be good if anyone wants to sign the petition for that as well.
Mhm.
Does anyone have any questions so far? Any questions or comments? Okay.
All right, and then so here I have this awesome app where you can contact your senators and get their information instantly. It's also like a mini newspaper where like they give you updates on any topics that they're going to decide on. And you can also, it also gives you an option to send your comment to your rep or senator about any bills that they are passing or they've signed or they haven't signed or they're going to vote on. Okay, so don't forget to call and email your senator or representative. That's about the most we can do right now. And the most powerful thing is also to vote. Don't forget to vote because voting is very important. This is how these aids are coming in for who that are targeting the marginalized groups. So for example, petition for expanding access to care, expunging the fear that immigrants have when accessing resources, and immigrants are essential to America, yet they are excluded from governmental aid. So don't forget to include those 3 points.
Something else as
Doing that.
well
Oh,
is
sorry.
that anyone who's well off with and receives a stimulus check, you can also provide help for those who don't receive any. There are different funds, like United with Dream has a fund to help those families who don't receive any stimulus help during this time. So I think that's also very important. Anyone who's well off and because undocumented families don't have access to this. Certain DACA recipients are if since they have a social security number and if they file taxes, this is accessible to them. But most of these families, they don't provide this to anyone. Yes, and so we have United We Dream has a healthcare access resource page. The Informed Immigrant has great information on there as well. We can share that to anyone who's interested. We'll also put it in the YouTube link and in the chat. So, Documented Limbo. So before COVID, initially our presentation was structured around a board game, which was Undocumented Limbo. And this game, it showed attendees, it gave attendees a hands-on experience into what it means to be undocumented in the US. And it debunked all the false stereotypes that you can just get in line to obtain citizenship. It provides different scenarios, and it's a great learning method for different populations. And if anyone wants more information on that as well, we can provide.
And if you would like to bring this game also to your campus, we are open to bringing it to your campus to have a way of advocacy as well on your campus.
Okay. And that was pretty much all we had for our presentation. So if anyone has any questions, comments, we can address them and just create a conversation.
How did you guys come across the board game?
So Lesley.
Yeah, so you mentioned that I attended this immigration conference at the Ignition Solidarity Network, and so during this conference, we learned a lot about advocacy. We learned a lot about immigration issues today, and then so the last part of the 3-day session was you have to do something now. It's your turn to advocate for others and not just hear it, but also do something about it. So I picked, I felt like most, in a way to attract people's attention is through a game, to do something and experience it fully. And so I was like researching on Google, and I was just looking through like games or like something interactive that everyone can do. And so I came across Undocumented Limbo, and so I kind of just brought it to St. Joe's and tried it there. And then me and Joseph went to Temple and other universities to present it. So it turned out really great.
Could y'all go back to your contact information slide, please?
So,
Gotcha, thank you.
so that's Joseph Mendoza at Rutgers.edu. And then those are emails. If anyone wants to contact us afterwards, we can definitely set something up, no problem. Does anyone else have any questions? Any information you would like to be clarified?
You guys had done this at St. Joseph's and Temple. Where else have you done it? And I guess where it sounds like you guys are like on a roll in terms of you know, like a worldwide tour. So like what's your like plan for the future? Like once, you know, we establish some sort of normalcy again.
So we attended the 2019 Ruby Jones conference on social justice at Westchester University. We did the inclusive leadership conference at Temple University. We presented at St. Joe's, and we had plans to present at Haverford and I think
Rowan University, Princeton University.
But with COVID, everything got a little messed up. So, but once everything passes, hopefully we can once again reestablish those dates, and we can go to different schools just to provide insight on this process.
Yeah, we're also trying to further develop the game. So the game is a bit outdated. It's from 2008, so before DACA. So we're working right now on trying to form our own game board and input our own little scenarios.
There are a lot of people in the participants that kind of do similar stuff to what y'all do. Like they have their own little seminars that they do, and you listed a lot of places, a lot of conferences. Could you share how you come across these conferences, these schools, and how you kind of approach them? Because you approached us, and it was really kind of just out of the blue and like a while ago, and we ended up working together in a lot of different ways. But could you talk about kind of where you get that confidence from to just kind of cold call, cold email somebody, and what advice you'd have for people who are looking to do the same thing?
Yeah, no problem. I'm a big believer on just cold emails, and if someone replies back, then that's good. Lesley finds a lot of conferences, and we end up just applying to them. And if we get an acceptance to go present, then we take our story there. At first, it's definitely not easy. At first, I was a little I wasn't so open about my status as DACA and just going out to different people that I don't know. I'm DACA. I'm undocumented. So that was a challenging transition, but I ended up noticing that telling people about DACA, telling people that what's happening, it's very helpful for them to understand. And many people are like, wow, I didn't know that was happening. And I know one conference, someone was like, wow, I never met a DACA student. And for me, what's happening now, it's normal because I see it all the time. I'm always reading about it, seeing what's going on, but other people may not really be able to see what's happening with the undocumented community. So that's what keeps me going. Just keep sharing this to everyone so everyone's informed, and they can help communities. They can help their schools become more inclusive. So I think that's what helps me to share this game with everyone else. And to be confident, I think once you just gotta throw yourself in places. We just apply, and then we go in and we tell our story. That's the biggest part. It's a genuine telling our story, and people appreciate that. They appreciate you being genuine, and they they like to learn. If they're open to learn, then it's definitely a great session.
Have you ever like encountered people that are just against everything you're saying, or is everyone pretty open?
For the majority of it, everyone is pretty open, but I think it's because the same people who have a passion for social justice keep coming. And so like one of my missions is to try to target people who aren't as open, try to introduce them to this conversation, try to keep an open mind. I'm trying to do that more at my predominantly white college, right, or university. For next semester, I'm going to be doing an Undocu week. So like advertising all over the university and trying to bringing all these types of people. But for the majority of it, all I've experienced is great open minds.
So I don't know if this happens on y'all's campuses. Hi, by the way, my name's Jay. When there are incidences of like hate speech or other actions towards like DACA, either on your respective campuses or somewhere like close by, how do y'all navigate those situations for other students that may encounter that?
So at my campus, I have not came across somebody who said something negatively about DACA or immigrants. But I don't know, have you, Joseph?
No, but I think it does happen a lot, even though we may not experience it, but it does happen a lot. And you said what are ways we can, what was the question? What are ways we can like?
I was just asking like ways that y'all would advise people to kind of not manage, but like kind of deal with those situations. For example, I know of a school that had an organization.
You know what my charger is? Oh, sorry, am I not muted? Sorry.
They had like a event saying that like catch the illegal alien or something, and they had like club members wear little signs on the back of their like shirts that say I'm a legal alien, and if you like caught someone and brought them back to the table, you get like a prize. And that was like a campus event, apparently. So I know that's like one specific incident, but I'm sure there are like other cases. And so for like students that are like seeing that firsthand or hearing it firsthand, what are some tips that you may advise to kind of help them maybe process through that?
I think definitely speak out, like speak up and make sure that you're not comfortable with things that are happening, especially in that way. Reaching out to different people in the university, especially those who are in charge, and saying this isn't right. But and it's not easy because that's that's terrible. So reaching out to people in the universities, making sure you're heard, because it may not be only you, but others in the university, others around you who may feel the same way.
Yeah, and so for St. Joe's, we've experienced many racial incidents, and the university approach to them hasn't been the best. But as students, we had to take on action and speak out and have protests. And now it seems like it's getting better, and they're listening, and we have a little more of a voice as a student body. So I think when the university doesn't react appropriately, I think like doing like protests or speaking out and demanding change is what we should do.
And I think those are really great points that both you and Joseph and Lesley pointed out. So like for students that are potentially interested in like advocating, like y'all were mentioning, what are some ways that they can start in terms of like gathering the support to like have like a more organized like protest or petition and etc. that you guys would suggest?
Right. Maybe like finding groups or at your university. For example, for me, it was very easy to start an advocacy kind of like coalition because at my university is Jesuit, so we have our beliefs as Jesuit is welcome immigrants. So through my campus ministry, I was able to form something that I was really passionate about. So finding the support, your support systems on campus is going to help you a lot. Do you have any?
No, I think that hits. Yeah, just find different support groups around the school and different people who are set to support undocumented or minority groups in your school. Maybe a center of inclusion or diversity, something like that would be beneficial to assist with this.
Great, thank you.
Wow, thank you. Any other questions? I think we're good. So, Chris, any final thoughts and final comments?
Yeah, I do have I do have one question for you guys, and that's and that's also not just for you, but all any other students on this call. Like, do you? So Lesley, you mentioned Undocu Week at St. Joseph's. Is like, has this happened before? And even if it hasn't happened before, like, what sort of programming, like regular programming? So like, you guys go on your talks, but that's like, kind of like a line. It's like not a. I mean, it is a regular thing, but it's not like a, you know, um, super frequent event. And so do you guys have like monthly like events, or like just like hangouts or get-togethers, to form a community, or any other kind of programming that you guys put on at your schools, or that you've seen other schools put on?
So I know I was supposed to do Undocu Week this spring semester, but due to the coronavirus, it got canceled. But I did have, we don't have an official kind of like undocumented students, mixed status family support group. I've been trying to also work on that at my university. It's just a little bit hard to target undocumented students because a lot of students aren't comfortable in revealing that they're undocumented students or they're from mixed status families due to like a lot of fear and the culture behind that. So I have, when I went to the immigration conference over the summer, another one of what we had to do was have an undocumented week back at our school. So I took a lot of ideas from a lot of schools in the West Coast, because a lot of schools in the West Coast have more those type of programs, those type of clubs and organizations at their schools, and like in the East Coast here, since the population isn't as much. But yeah, it's just like, for example, one of the programs that I was going to do for that week was we're going to do a vigil. We were going to do something called cafecito con leche, which is like we all just kind of had like an hour to 2 hour session to just kind of like let go of our our beliefs and what we felt like being in a mixed status family, what it meant to be an undocumented student, and just all of those burdens that come with it.
Yeah, we don't really have anything set, but we are hopefully to work on this year to find more schools to present at, and see if there's any other conferences. But hopefully we'll expand Undocumented Limbo. So, but we're like in our starting steps still.
Yeah, and our two kind of main missions, for both of us, is to encourage advocacy on their campus when we go visit schools, to encourage advocacy on their campus, either on immigration, criminal justice reform, environmental justice, any type of advocacy that's important on their campus. And also voting is a very big, what we stress during Undocumented Limbo, voting.
Gotcha. Thank you. That's all for me. If that's all for everyone else, we can close up shop. So yeah. So contact info is on this slide. We'll share. You guys went through lots of resources that I want to expose. So we'll talk after to make sure we get that thorough list of notes and resources. We'll post that on social media, on the YouTube description of the video that we upload after this session. Video should be up by midweek, and everyone on this call, please share as widely as possible. And yeah, if if you have any questions, to direct to Lesley and Joseph, you have their contact info. But if you have any questions you want to direct to Michaela and me for on the Align side, we're Align al1gn.leadership@gmail.com. Michaela has already beaten me to the punch again and typed out our contact info. So if you want to continue hanging out with us for part 2 of Align Online on this April 18th, Chris and Claire and Flip National will be or from Flip National will be presenting in half an hour. But if this is all, then have a great weekend and a great weekend. Stay safe. So thank you for
Sorry for
tuning
yelling, everyone. Bye.
in. Bye.
You're good. Take care.
Bye.